Mental health is not necessarily the first topic that springs to mind when thinking about the medical challenges facing Africa. Issues such as hunger, drought and HIV/AIDS tend to receive the headlines. But those problems can also have a major impact on mental health across the generations. The young, given their vulnerability, can be particularly affected. Poverty can provoke a tragic downward spiral.
There's a vicious cycle whereby poverty causes mental ill health, and mental ill health in turn causes poverty. So poverty causes mental ill health through a number of mechanisms. For example, if you're poor, you're more likely to have obstetric complications. That can cause mental health problems. You're less likely to have access to social networks, social support systems. Those can cause mental health problems. You're less likely to have a good education. That can cause mental health problems. And there are a number of other mechanisms as well. Once you have a mental health problem, that predisposes you to being poor or to deepening your state of poverty.
Professor Flischer has been one of those involved in a study entitled The Mental Health and Poverty Project. Stigma towards mental illness can be a particular problem in Africa. It can lead to tragic consequences in the misunderstanding by the general public of a physical disease such as epilepsy.
The belief is that it's caused by demons, it's caused by spirits which take possession of the person. And so we find that a lot of parents would abandon their children with epilepsy. They would just take them to another city and leave them there and disappear. So, for example, I work in an institution with young abandoned children, and a lot of them have epilepsy, and they were abandoned by their parents. So it's basically, and then they also believe that, when a child or somebody has a seizure, they could produce a lot of foam. There could be foaming and saliva. They believe the saliva that comes out from the mouth is infectious. So if it touches another person, that person would now have epilepsy.
The picture is certainly not all gloom. The very fact that mental health professionals from around the world are sharing knowledge at such a conference is significant. All the more important from the continent's perspective is the work of the African Association for Child and Adult Mental Health.
We're beginning to see what we can do for ourselves in Africa, how we can create awareness, how we can help the African child to have the optimal mental health possible, how we can lobby governments and push for policies that would help the mental health of the African child, and also the African child, the future of the continent.
The work of such an association has been described as finding a collective voice to meet these challenges. Also important is ensuring that the highly qualified professionals in mental health from Africa do not become part of an increasing diaspora, but remain or return to provide better healthcare in their own countries.